Human Services meeting to order. Madam Chair, roll call, please.
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki.
Here.
Commissioner Dobb.
Here.
Commissioner Anderson.
Here.
Commissioner Killeen.
Here.
Chair Baker McCormick.
Here.
Have a quorum present.
Next item.
B, Chairwoman's remarks.
I have none. Well, you know what? I do have one. So earlier today, I attended a press conference with the governor who announced that we are officially open again. So I am so grateful that we all, thus far, we made it through okay. And although we, of course, family members or others that were impacted by COVID and may have passed away. And because of that, we decided to give an event to honor the lives of those lost and to the frontline workers. The event, and it's a tribute and remembrance concert, a music concert, is going to be held July 14th on Belle Isle, and it is from 4:30 until 8 o'clock. You're all welcome to attend. And again, that's July 14th. Thank you. That's my remarks. Next item, please.
C, approval of the June 8th, 2021 meeting minutes.
Is there a motion?
So moved to approve.
Support.
It's been moved and supported. Any discussion? All right. All those in favor?
Aye.
Anyone opposed? Any abstentions? All right, if none, the motion passed. Next item, please.
D, unfinished business. There is none listed.
Next item, please.
Item 1, under new business, an update from Dr. Mahanat Hamami regarding COVID-19.
All right, Dr. Hamami, welcome.
Thank you, Madam Chair. Good afternoon. Mohanad Hamami, Chief Health Strategist for Wayne County, and I will be happy to share with you my screen as
Okay,
usual.
and before you go into your presentation, I think Ms. Allen, Janelle Allen is on the line and wanted to say a few words.
Sure.
Yes,
All
yes,
right.
thank you,
Ms.
Madam
Allen.
Chair.
Mhm.
I'm Janelle Allen, Chief Operating Officer with the County Executive's Office, and I'm here to share some news with everyone that this is Dr. Hamami's last week with us, that it is bittersweet that we say this because I know that he's probably going to take some very well-deserved time off. Dr. Hamami shared with me that he's never taken time off between jobs. But I wanted to personally thank him here because, as most of you may know, this was his second tour of duty with us. And Dr. Hamami returned at a time when we were in greatest need. And he personally helped me so in leading a lot of our COVID response. So I wanted to share that news with you and to personally thank Dr. Hamami on behalf of the county executive, on behalf of the health division, on behalf of our whole department and myself for all of your dedicated service. We could not have gotten to the point that we are without your service. Thank you. Wish you all the best, and we'll definitely still be in touch.
Yes, that is, we are definitely sorry to hear that you're leaving us. I know I've gotten to know you over this short time span that I've been the chair, and you've always been on point and on task, and you did a wonderful job helping the county through this pandemic. So we thank you for your contribution to Wayne County.
Thank you very much, Madam Chair, and thank you, Janelle, and I certainly thank everybody for their support and for the opportunity. I was saving that towards the end of my presentation, so I believe you can see my my screen, hopefully. Okay,
Yes, we
great.
can.
And we are covering the period between June 13 to June 19, as always. So starting with our COVID cases for this period, we continue to see the decrease. We are now looking at levels that are very much not have seen before, and between every period we are seeing even more decrease. For example, last week we saw 143 cases only. That is about 44% decrease from the period before or the week before. Death is still within the same range. There has been a little bit of more identified cases. As you know, the death records keep being updated for the cause of death, and that is why sometimes it fluctuates in seeing more 1 week or 1 period. But again, I love looking at those graphics where it truly can tell you where we're heading. And you recall probably it wasn't too far ago, 2 months ago, this slope was heading in the wrong direction. Now it is going literally down. We are averaging, if you look at the 2-week period, we are averaging about 29 cases a day. So again, these are the trend. This is the trend that we would like to see, and these are the numbers that we wanted to have. And this is where we were from the first case that was identified in Wayne County as COVID-19 till we are today. And as you can see towards the end of the slope, we are now at levels that almost, not there yet, but almost where we were before the first peak or before March. Our positivity rate, again, we are probably at the lowest we have seen as well. And 5 weeks ago, we were at 9%. Now we are at 1.3% in Wayne County. Compared to the state, we are exactly where we are. And the city of Detroit is slightly 0.1% higher than us in terms of positivity. But again, if you look at the periods, we are going down in terms of our positivity rate. The communities that we are seeing with the most cases, again, the absolute numbers have been decreasing. In fact, we have now communities that are in the single digits, as you can see, 9 cases, 4 cases in Allen Park and Harper Woods and Lincoln Park. So again, this is great news. However, we have traded the #1 spot for the 3rd week in a row between the city of Dearborn and the city of Hamtramck. Hamtramck now has the highest percentage of all cases in Wayne County, although their numbers have dropped in total cases, but they are now more than the city of Dearborn. Dearborn comes in 2nd place at 11%, followed by Dearborn Heights at 10%, and then Redford and the rest. But as you can see, those 4 communities are still in the double digits, but we are going in the right trend. As we are seeing, these are also the communities where we are seeing some of the pockets of lower vaccine rates, especially in the younger population or the younger age group. So that also is something that we need to emphasize on. Our variants have been also almost plateauing. We probably had 20 more cases of variants. Mostly it's the B117, which this is the UK variant. One good news is that the Delta variant or the India variant has been steadily at 4 cases since April. And this is great because we know that this is one of the variants that is of the highest concern because of how fast it spreads, and especially for those that are only vaccinated with 1 dose versus 2. So it's great that we are not seeing more of the India variant. We haven't gained much in the others, probably 1 case here and 1 case there. But again, the majority is the UK. So again, it means 2 things. One, that our mitigation and isolation and case investigation has been very robust in limiting the spread, but also the vaccine is contributing as well to the protection. Speaking of vaccine, this is our vaccination inventory as of last Saturday, we have more than 300,000 doses of vaccine received. We have administered about 175,000 and redistributed. That means we gave doses to providers that are now vaccinating close to almost 89,000. This is expected as we are now dwindling as an administrator, but as a distributor, even I was talking to Carol earlier today, in the state's initial plan that was released back in October, they were looking at the health department as the hub that is now providing vaccine to providers. So we will see our role continuing in that regard, but still we have all our sites available to administer vaccines. With the last week of school, we were also at several schools. And as you can see, we were in Belleville and Harper Woods and Redford Township and Dearborn Heights. We vaccinated a total of 229 individuals, of which almost 80% were students. We have arranged still, we still are in communication with RISA and with those schools to go back, even if the school is closed, to go back for a second dose. And if there is a need to do more, then we are more than willing to do so. However, all of our Pfizer sites are open for 12 and 15, or 12 and older, actually, and we are seeing people that are coming. This is the heat map that many of you have seen from the Michigan Lighthouse, and we are getting more and more green across Wayne County, but yet we are seeing some of those still light pink zones where it means we are below the 50th percentile or the 50% of people vaccinated. So again, we want to focus on those, and I know that Ms. Jordan, our director, has a plan in place, and we're looking at how do we now start shifting to targeting those communities where some hesitancy and some reluctance is that needs to be addressed, and to improve the numbers there. Our age groups as of the vaccine completion, as well as vaccine at least one dose, is very good. We are above the overall in Wayne County. We are at almost 63% of people that received at least one dose. More than half of the population in Wayne, or the eligible population in Wayne County, has been fully vaccinated at 56.2. Our biggest percentage is in those that are 65 and older. 65 to 74 are about 85%, with 80% fully vaccinated. 75 and older are 80%, with 75% fully vaccinated, and the rest of the age groups, as you can see, are following in the right trend. The lowest, as expected, because we have been doing this now for 5 weeks only, is the 12 to 15 years, and we have initiated vaccine in almost 29%, with 20% fully vaccinated. We still focus on the younger population, and specifically the 20 to 29, which are relatively the lower age group that has been vaccinated. However, from week to week, we are seeing an increase in those percentages. So it's not standing still, which is very encouraging. These are the numbers as of yesterday. I went this morning on MDHHS dashboard and got updated those numbers. As you can see, Wayne County is at 63% almost, and 57% fully vaccinated. We are trailing behind Washtenaw and Oakland County. We're doing much better from other counties. And the encouraging part is that now half of the state of Michigan is fully vaccinated. So again, this is going slowly, but it's going steadily, and we would like to see that continue until we reach what constitutes a complete and herd immunity. I want to again reiterate my thanks for everybody that supported us, and specifically in the last almost 8 months that I have been with you. I would like to thank Mr. Evans and Janelle for giving me the opportunity to serve our county residents, but certainly our team at Public Health, Carol, and everybody at the health department for their dedication. Our nurses are amazing. Everybody from whoever is answering the phone all the way to our epidemiologist has been putting extra long hours and has been putting all the time and dedication to make this possible. And I am proud that I have been part of this. Wayne County is still my home. I'm not going anywhere, and I told Janelle, I'm always a phone call away, because when family calls, then you answer. So thank you very much, and I appreciate the opportunity.
You're muted, Monique. All right, let's try that again. Again, thank you for your service to Wayne County and to the residents. We really appreciate all of the work that you have done. Commissioner Colleen, you have the floor.
Thank you, Madam Chair. Dr. Hamami, I saw the Delta variant being referred to in print media, that the CDC calls it a variant of, I believe they said, special concern or something like that. Is that an actual term of art? I mean, what is it about the variant that the CDC puts it into that category of special concern?
That's a very good question, sir. One of the observations with this specific one is that it, first of all, it spreads very fast, but it also is more virulent in those that have been half vaccinated, i.e. those that received only one dose. And this is where it's different from the others. So although the CDC used two terminologies, a variant of interest and a variant of concern, to give that a little step ahead, or little category of more concern, is because of that trait. And again, this emphasizes the need for people that have been vaccinated once to get this second, and that's why.
All righty, thank you. And I know we have Wayne County numbers, but I assume you watch Detroit numbers as well, not reporting them here, because I'm eyeballing, especially with the Delta variant, 70% of the population in the city of Detroit is at pretty good risk. 63% is at serious risk that haven't been vaccinated at all, and another 10% that have one. So what do we know about the number of Delta cases in the city of Detroit?
We do have those. Our epidemiologists can provide those. Again, I think overall the Delta variant in at least our neighboring counties have not been as high as the others. So again, the UK variant has been the more prevalent.
Well, yeah, I get concerned though, because the UK variant, the vaccines, the single dose vaccine works much better on the UK. And of course, as we just saw in the Yau County, but I just continue to be concerned about the low vaccination rates in the city, especially with the Delta, because I believe the Delta is now, I can't remember now, either 40 or 60% of the cases that are in the UK, and that's why they've shut down for another month.
That is correct.
Yeah. And also, Doctor, unfortunately, it's the Zoom world, and it's been so great working with you since you came here as a department head. And yeah, it's just been terrific, Doc, just getting to know you and working with you. You're so easy to work with. You're on top of things, and how engaged you are. And I was so disappointed we lost you there for a little minute, then you came back to fill this very important function. So from the bottom of my heart, Doc, thank you for the public service. Thank you what you've done for this county, for the people of this county, as well as for Wayne County government. So I'm glad you're not going anywhere. So I know that I'm going to see you down the road, but thank you very much for your service here. And thank you, Madam Chair.
Thank you, Commissioner Colleen. Commissioner Dowd.
Thank you, Madam Chair. Dr. Hamami, Commissioner Colleen touched a little bit on my question, but I'm wondering, you know, we look at the vaccination rates for Wayne County, and we sort of look at city of Detroit, and we look at the state of Michigan. But I'm wondering if you have any information or insight on vaccination rates of the country as a whole and also internationally, because, you know, it's great that Wayne County is at a certain percentage, but we don't just all stay in Wayne County, and we don't, you know, not have anyone come in from other counties or other states or other countries. So I'm just wondering what you think, how we're doing as a country and how we're doing as a world, you know, globally, and you know, if you have any information or insight on that.
Right. I think I shared last time that, yes, there are varying rates across the nation. In the United States, we have states that are almost at 80%, such as Vermont. There are states that are in their 30s, such as Georgia and others. So, yes, it is not a unified number, even though if you look at, let's say, the CDC website, you might have a uniform percentage around, I think, 45 or close to 50%. That's evening out those. It is something to consider, and I think this is where, although many of the recommendations now about face covering, about the physical distancing are just recommendations and people are letting their guards down, it is still a good idea, especially in certain populations, in certain situations where we still want to observe those and make sure that we are not out of the woods yet. We are getting there, but still it is something that we would still recommend practicing caution as we are approaching those phases. As far as the world, we are doing better than many of the rest, and part of it is the availability of vaccines. There has been other vaccines that other countries are using, and they have also some efforts. One comforting level is that the travel industry is still requiring a negative COVID test for anyone who hops on a plane internationally. So for example, in next week, I'm going overseas. I need to have a test that is 96 hours prior, and the same applies for those coming in. So that gives you a little bit of at least some safety, but yet to get to where we want globally in terms of vaccine rates, and hopefully at some point have what some European countries are considering as vaccine passports. I think that would be the ideal situation.
Okay, yeah, I was also going to ask about any travel restrictions or requirements of testing before anyone travels globally. I know that we still have our Canadian border still closed,
Yes.
but I don't know if are there any other countries that we have closed borders or restricted travel to at this time?
Not that I know of, no.
Okay, that was the only question that I had for you today, and I also want to thank you so much for your service and helping us out at this difficult time. It was a pleasure to get to know you. Thank you so much.
Thank you, Commissioner. Thank you.
Thank you, Madam Chair.
Thank you, Commissioner Dobb. Commissioner, I think it was Marecki that was next. Is that correct?
I don't know. I'll be short though.
Sure.
Thank you. So, Doctor, even if you are fully vaccinated, you still have to have the test before you leave internationally and come back?
Yes, yes.
Oh, that's a good deterrent not to go this summer. Okay, so it's not making a difference.
But
then,
tests,
huh?
Commissioner, tests are becoming so available and so easy. You can get it in 12 hours. It's not, it's an extra safety measure that I think everyone should take advantage of.
Okay. All right. That's the only question I had going off of Commissioner Dobbs, but it was such a pleasure to work with you again. I was so glad to see when you came back, but thank you for everything you did. And thank you for everything you did for my district with the vaccines. And it was wonderful. And I really, really enjoyed working with you. And I hope you have a nice time off in between what you're doing.
Thank you. Thank you,
So,
Commissioner.
Hope to see you again.
Thank you, Commissioner Marecki. Commissioner Anderson.
Thank you, Madam Chair. I also wanted to add my thanks to Dr. Hamami and what he's done for Wayne County. All of our residents helping to put together this program with its support and tight work on behalf of the county with Janelle and others and Carol Osterberry and everyone else that have been a part of this team. It has been phenomenal. It was a little bit of a rocky start at the very beginning, but I think a lot of it was that the expectations were, I guess, that it was going to be instant, that the vaccines were going to be all available, and people were, I think, getting very anxious, and of course then they were contacting their commissioners in a lot of cases and caused some anxiety, I think, certainly among myself a little bit. But I wanted to thank you for all that hard work and what you did for us. I also wanted to mention maybe to the chair, maybe we could do something for Dr. Hamami and with a resolution or something from the full commission. So hopefully we can do something like that very soon. Dr. Hamami, when is the actual date that you're actually leaving?
Friday is my last day.
Oh, wow. Okay.
So you guys got my final presentation. Yeah.
Okay, so we may have to make sure we get your address some way so we can send something.
I'll be
to you.
honored. Thank you, sir. I'll be honored.
We
And I
can
wanted to
definitely do that. Mhm.
Okay, great. I was wondering, since Carol's here, Janelle, and yourself, are we available? Do we know of available sites for the rapid test? And the reason I ask is that someone had contacted me on behalf of someone. This individual worked at Enterprise Car Rental, and someone from Canada was either renting a car at the time for her time here on the state side, and was looking for that quick test because I guess to get back into Canada, even though she's a Canadian citizen, she had to have the test done. And and it had to be something that had quick results.
I would lean on Carol on that, but I know that as the county, we have not invested so much in the rapid test because of the accuracy. Most of our tests were the full PCR, but there are plenty of labs, plenty of urgent cares that across Wayne County that do provide that. I think some of them you can get it within 4 hours, but they're not run by us. But these are easily identifiable, as in who can administer that. Carol, do you know of the
Right.
top of your head, anybody?
Yeah, Carol Osterberry, health officer. And yes, many, virtually all the urgent cares have the rapid antigen testing available. And yeah, we've got I know our links on the website, but yeah, like you say, across the county, but we did not, we were just for the PCR tests, we're the county sponsored.
Is there any, one more question, Doctor, is there any accuracy test or any reports that you've seen as far as the self-tests that are available now? I believe they're available in drugstores now.
Yeah, I did not get any of the solid numbers. I know those in their early stages were at, I think, 85%, so not as accurate as the rest. I know there has been some improvement, but I didn't see any solid papers on that yet.
Okay, all right. Thank you. Thank you, Madam Chair. That's all.
Thank you, Commissioner Anderson. If there are no other questions, I think we can let you go. Unfortunately, but fortunately, I guess. Thank you again, Dr. Hamami, for all that you have done. We really appreciate you.
Thank you, Madam Chair. Thank you, everybody.
All right, so we will move to the next item, Madam Chair. Madam Clerk.
Item 2, a presentation by Tom Coaches of Wayne County Healthy Communities to discuss the organization's relationship to the county and its management of the county's 2 federally qualified health centers in the cities of Hamtramck and Wayne.
All right, welcome. Are you
I am here,
You're here? Okay.
ready to talk a little bit. Thank you for allowing me to have this opportunity. Before I get into the relationship with the county, I want to make sure everyone knows exactly what we do. And I think I heard where our locations were just now, which is very accurate. We have an east side out Wayne County, and we have a west side out Wayne County location. Wayne County Healthy Communities, as you should be seeing now, is a federally qualified healthcare clinic. Amal, if you could show the next slide, that'd be great. There we go. So our mission statement and our story. The fact of the matter is we were developed in 2012. I worked right before I came downtown. Dr. Hamami and I actually worked together on these for quite a while. Wayne County Healthy Communities is a 501c3 not-for-profit corporation created to operate the Wayne County grant and the federally qualified healthcare clinics. We initially started with one clinic here in the Hamtramck community. About 5 years later, we opened up in the Wayne community, right inside the Health Administration building. Reopened their dental suite there that was been closed for years, as well as our other services. So we're a co-applicant on the HRSA grant with Wayne County. We received our ambulatory healthcare accreditation for being a patient-centered medical home in 2017, and we just renewed that this past year. They actually came nearing the end of 2020 and into 21 at pandemic. They still came in person to visit us. So you can see we received that accreditation again, and we continue to strive for that. It's sort of for those of you who have been in healthcare, it's the Joint Commission of Ambulatory Care. Next slide there. Our services: primary care, dental care, behavioral health, women's OB and GYN care, pediatrics. We partner with the county to provide WIC services, lots of immunizations, lots of education on HIV PrEP programs, opioid dependence treatment programs, including Suboxone and Vivitrol. We've offer integrated behavioral health. We did have the opportunity to present our programs on Fox 2 a few years back. Before the pandemic, when everyone talked about the opioid toxicities. It's gotten a lot worse during the pandemic, and yet we need to make sure that's still in the forefront, and we try to offer those treatments. A little bit later, I'll talk about a program that we've cooperated with the Wayne County Jails and Wayne State University to work together on to continue that help. We do offer peer recovery coaches, and we refer out as needed. Some of the things that we did to make this happen and try to figure out, are we doing the right things for our patients that we serve? So we put up a little slide there that talks about the social determinants of health and the barriers. And I don't want to go over every barrier, but I think a lot of us are aware of it: transportation, language, burnout, patient time constraints, no insurance or limited insurance. So if we go to the next slide, we'll show how we addressed every one of those. We've partnered with Uber Health, and we provide free transportation to our clinics. We have navigators here available in the clinics, which will help people enroll in the different insurance programs. Our staff speaks about 5 different languages total. On top of that, we use translation service as necessary. We strive to have the languages available in person. It just makes for probably a little stronger what I call healthcare visit, whether it's wellness or acute. We have case managers to assist in getting housing, follow-up services, referrals. We work with immigration resources. In one of our communities here in Hamtramck, we have a highly diverse population and have quite a few immigrants, and we work successfully with them. Community partnerships, we try not to reinvent the wheel. We try to work with the wheel. So we have many opportunities. I gave an example there. We also partner with Michigan State College of Extended Learning, which is also under Health, Veterans, and Community Wellness. We do health education both with our public health students and develop our own in many languages, or we will work with our electronic medical record to develop handouts right off the EMR, as I call it, our eClinical Works. Next. Okay. talk a little bit about affordable care. We never turn a patient away. If someone comes to us in need, that patient will be seen regardless of their ability to pay. And so that's across the board. It's a standing. We get that patient in. We'll worry about the payment method later if we have to. We never go to collections. My board won't allow that anyways, but it just is not the right thing to do to these people that we're servicing. 60 to 70% of our patients are either no insurance or very poor insurance. And so you can see how our sliding scale comes into play. The slide allows us to reduce a primary care visit down to $5 based upon the family size and the income levels. We actually go the $5 and $20 route primarily. Anyone above that has a higher brand of insurance. We hope they come to us because we need those to help us maintain our revenue stream. That our 60 to 70% of the population we serve comes to us at the lowest slide possible. We have offer insurance assistance. Like I said earlier, we have navigators. We'll work with them to get insurance. We work with the state to get different programs in. We work with the state right now on a Wise Woman. We work with the state on flu vaccination programs. We actually work with the state on our COVID vaccination programs, as well as working with Carol and Dr. Hamami and the public health group. These are our partners that we work with. So we love to do teaching. We work with 3 different schools from the University of Michigan, both Ann Arbor, Flint, and Dearborn. We work with Wayne State University grad students as well as their medical school. We work with Oakland University, both their grad students, their undergrad public health students, as well as their medical school. We have 2 dental clinics, which we're, knock on wood, we're finally going to get up and running again July 12th. We were having difficulty getting a dentist to come back and work with us, but we have that set up. And we are also fortunate enough to get funding from the state prior to the pandemic to put in a dental clinic here at Hamtramck, which we did. And we'll have 5 operatories at Hamtramck, as well as 5 operatories in our Wayne clinic. The Hamtramck operatories, we hope to have up and running by August 1st. They have been completed, and we're waiting on putting in the IT there. We work with the Wayne State University Physician Group for behavioral health psychiatric services. We work with Western Michigan University for their PA and MD schools. We have a couple unique programs. The Wayne County Jail, you might have heard of this one already. I don't know if I'm repeating it to you. I apologize. We developed a position called Disease Intervention Specialist. We put those in the jail at the start of the pandemic. We worked with Jennifer Caruso and Mr. Dunlap over at the jails, Chief Dunlap, and we began to assist in the COVID. Not so much the testing, an outside company came in for that, but all the paperwork that goes with it, scheduling the test as well as doing the tracing and getting back to the appropriate people afterwards. As you're probably aware, the Wayne County Jail sometimes has a high turnover, so we had to contact those released inmates and make sure they get the proper information or the families of those inmates whenever possible. Early on in the pandemic, we partnered with Gleaner Food Bank as well. So far, we usually passed out probably about 3,500 food boxes. We have a food distribution every month here at our Hamtramck clinic. I wanted to show you some of the encounters. That's a very small slide, but we take a look at it every month. We share this with our board members. But the far right, you can see that deep blue line and the line next to it is all COVID-related activities in our clinics. The primary care is finally starting to come back. Our patients were afraid to come in, and telemedicine didn't work for a lot of our patients because of the language barriers and not having appropriate use of information technology in their homes. But that shows you our outreach visits, our Medicaid, Medicare enrollments, as well as our COVID, primary care, OB-GYN, and dental will be back in service by July. So that's a quick review, hopefully not too quick, of what we offer. We're work under the clinical division. We work with the clinical division of Wayne County. Ms. Jordan, it's a pleasure to meet you. I heard you were coming, and so I'm glad to see your face, and I hope to see you soon here at one of our clinics. Thank you. Jennifer, I want to
Look forward to meeting you also.
All right, thank you. Jennifer, I want to thank as well. We worked strongly with Ms. Caruso to deliver these services. It's a unique relationship. As some of you HHS board member, committee members recall, you approved an agreement, a cooperative agreement, which is between Wayne County Healthy Communities and the Wayne County. That agreement is signed by the Board of Directors of Wayne County Healthy Communities. It is then brought to HHS committee downtown, and then it goes to the full committee, and then it goes to Mr. Evans for final signature. That agreement is reviewed every 3 years, and so we're about, I think we're in a year and a half. So that defines the relationship of how we work with Wayne County. So Chairman McCormick Baker, I didn't know exactly what you wanted. I hope this sort of it fits in. You know, I'm available. I love to answer questions. I love to talk more about the clinic. You know,
Thank you. Thank you. That was perfect. Just enough information. Actually, the Vice Chair, Commissioner Colleen, recommended that we have you on. And prior to COVID, we were actually going to meet, and then COVID hit, and then, you know, where we are now. So we're glad to have you, and thank you so much for coming to our meeting with that presentation. I just had a couple of quick questions. What are your current hours now?
we offer 9 to 5:30, Monday, Tuesday, Thursday, Friday, 11 to 7:30 on Wednesdays, and every other Saturday, full days, 9 to 5:30 at our Hamtramck location. In our Wayne location, we follow the hours of the Public Health Department because we're located right within the Public Health Department, and that is 8 to 4:30 Monday through Friday that we're there.
Okay, great. And the dental programs, the one that it will be in Hamtramck, you said starts in August. Is that correct?
We hope to have it. Our goal is August 1.
Okay,
So that's a new program.
right.
It's not been instituted. We had the Dr. Nunez out here about 2 weeks ago. We recruited him through the University of Detroit Mercy. He will be on faculty there at UDM. He comes to us from Case Western down in Ohio, so he's relocating up here, but will commute in the interim if he doesn't find a place. Right now, he's the only dentist we have, so we might open up 3 days, 2 days, 3 days at one location, 2 at the other, just to get it kicked off. And we continue to try to recruit through UDM. The memorandum of understanding we have is they provide the faculty and students, and we help get the patients in to see in that program.
Great, great. Thank you. Commissioner Colleen. You're muted.
Unmute. Yeah, I'm there.
All right.
Yeah, not as quick as I used to be on that old cursor. Thank you for joining us, Mr. Coaches. It's certainly good to see you again. Another person that used to work in the Health and Human Services Department here at Wayne County. A couple of questions, and the reason I suggested to the chair, does Wayne County Healthy Communities get any general fund support from the Wayne County budget?
No, we're completely funded through HRSA grants as well as grants we apply for on our own. And we work closely with the Michigan Primary Care Association, and they will sometimes get grants from the state of Michigan, and it's spread across all the clinics here in the state of Michigan. I think it's 23 upgrade fees.
And I'll just say this to staff because we have it somewhere. If that agreement that you referred to that we're, what, a year and a half into with the county, Mr. Coaches? If somebody could send that back out so all the members of the committee can see what is included in that agreement. Is it something about staffing and doing a little sharing or something like that, Mr. Coaches?
Not really about that. It's more about how we operate the clinics and what Wayne County supports and does. Mr. Winter is on phone call here, and I think, or the Zoom call. I think he helped put that together. Am I right, TR?
Yes, the agreement is pretty much structured the way HRSA wants to have it as our.
TR, I don't want to get into that conversation today, the weeds of that. If we could just see that, and I can, and I'm glad we're expanding our dental, Mr. Coaches. Perhaps the only thing rarer than a general practitioner in the city of Detroit and Hamtramck Highland Park is dentists. And I can recall hearing from the juvenile detention facility going way back when I got here, that their kids would come in there at 16 years old and a dentist never looked in their mouth. And they would say, you would not believe what we see in the mouths or don't see in the mouths of these kids that are coming. So I'm glad we're expanding our dental. And you do that all with grants, correct, sir?
That's correct. We, quite frankly, we try to break even on an operations basis. So we are limited to what we can do by the amount of money we bring in. With grants.
Well, I was going to ask you about that too. How's the revenue stream looking?
It's getting better these last couple of months. We are getting some revenue from COVID vaccines that we were giving. We were giving the Moderna vaccine here, and of course we started with some J&J. That didn't last us long, and we had some difficulty with that since then, getting people in for it. We're offering now vaccines to walk-ins or appointments. We've had vaccine clinics on Saturday as necessary. The last one we tried to hook up with our food drive, so we had a food drive as well as a vaccine clinic on the same day, trying to get people in. We have board approval to try to come up with an incentive to get a younger population in. I'm concerned about back to school in the fall, obviously, like excuse me, a lot of people are, and what the schools are doing. So I know the county has done a great job with the Pfizer vaccine and offering it to different high schools around town. One of my grandkids got it at the Plymouth Canton school complex out there. So I know it's available, and I know the 13 to 16-year-olds are getting it. I anxiously await the Moderna emergency use approval for that same population, because they approached the CDC on that in the advisory panel a while ago. So until then I might take Carol or Dr. Hamami's suggestion, and Carol still being there. If I have to, I'll get some of the Pfizer vaccine out here to start giving that at the same time to that group. We did purchase the appropriate freezer capabilities to do that. So I saw Carol came back on there with a smile. But Carol, we might be talking very soon about that.
Thanks. A couple of more things here, Mr. Coaches. And along with the trend in revenues, how's the trend in the number of people visiting us? And what I'm going with both of these questions is, at some point, will HRSA start saying to, and I believe they do, your revenue stream's not good enough, the number of patients you're getting isn't good enough, so maybe we don't want to fund you anymore. Is that, can HRSA get to that point, and how are we doing on that continuum?
Well, we've never, we're doing fine on the continuum right now. They're not addressing it through the CARES Act or the American Rescue Plan. So we received, and you folks approved $1 million on the American Rescue Plan, which we're spreading out over 3 county fiscal years. We also received our CARES Act money. I think there's recognition. I've talked to the HRSA people myself as well. They were more concerned about us assisting, as President Biden said, he wanted to get the FQHCs involved in the vaccination program, which we did, and we followed through. I've never heard of it, Commissioner Clean. I've been doing this for a few years. as I know you're aware. I've never heard of HRSA taking away that grant.
Okay.
Based upon that, they will sometimes reduce your grant dollars based upon the utilization of what they see in the Uniform Data System report, which is done once a year, and they compare the trends. But they've been good at recognizing the situations that we're in and the population we serve. You know, we're the backstop to the emergency rooms. And so what the worst thing they want to do is get emergency rooms backed up again at this time. So that's how I look at us, is that backstop. You know, we provide all of our services at as most efficiently as we can. My example there is I have midwives that do my OB-GYN service for us with partnerships with the OB-GYNs in the community, both in Western Wayne. We have a Beaumont OB-GYN, and here in Hamtramck, where I am today, we have a Hutzel OB-GYN practice that we work with. But the bulk of the work is done by a midwife. We have we train what I call DNPs, or doctors and nurse practitioners, with Dr. George from Wayne State University. She actually works for us one day a week as well. And I also have a couple other doctors and nurse practitioners working with our chief medical officer. So it's a little bit more efficient, and they still get a high level of care. And so that's how we approach it, and that's how we're cost effective.
Okay. You anticipated, I think, one of my questions a bit. The ARPA money, the Recovery Plan Act, does that come through the county, or since you're not directly a part of the county, do you get it separate right from Washington, D.C.?
The county, HRSA gives it to the county, and we have some of that cooperative agreement that they'll be getting and reading about. HRSA gives all the money directly. We work with the HCCW's finance division. You know, we work with Kamal and Ernestine and Regina Lee and getting that money. We work closely with them with audits. We just had a recent audit that we worked together with on that, but that money comes through them. We're made aware of it. Jennifer has now been appointed the project lead, I believe it is called, on the HRSA website, because when we had all the changeover, it was actually Brian Manning, if you can recall. So we've got it back into someone that works closely with us. We get the information a little bit more timely, which is beneficial. And we work with the county to create a budget, and then we send it through the appropriate channels, and it gets presented to you folks, and then it goes to the full commission.
Okay, because there is a big section of the recovery plan, ARPA, that is dedicated to getting our health a lot better in all of the areas we're talking about here. So hopefully there's a fair number of dollars. I think it's fair to say with the poverty in Detroit and Wayne County that our little area of the country here is underserved with FQHCs as compared to metropolitan areas around the country. We're going to get some more FQHCs here, Mr. Coaches?
If you're talking about with the county grant, that was part of a long range plan we had. We'd like to work one in. This is strictly off the cuff now, Commissioner Green, but we've talked about trying to get one into the downriver area.
Yeah.
Upriver in the downriver area, as I call it. So in the Rouge Ecorse area, off of Jefferson Avenue there, which is also a highly needed area for healthcare. You know, you've got some excellent programs already in FQHCs that I was proud to be a part of when they first started, and now have developed even more. So the Wayne County area, that's probably the biggest next area I think that we have concerns. And when I say Wayne County, we never turn away a resident from Macomb County that needs our services.
Right.
A city resident. It's just the terminology I'm using out Wayne County, but I do individuals from Warren here, Centerline, Detroit. We don't pay that much attention to the zip code or the address.
Well, and it's for that exact purpose that we need to have more clinics that people, regardless of their situation, could just walk into and get services. So I'd like to help with any effort to get a few more FQHCs. And thank you for the work, and thank you, Madam Chair. I know I had a few questions. Thank you for the time.
Right. Thank you, Commissioner Colleen. And Commissioner Dobb had a question.
Yes, thank you, Madam Chair. I've got a couple questions about the behavioral health services that the clinics provide. Are they offered at both locations?
They're offered full-time at both locations.
Okay. How many therapists do you have?
Two full-time therapists, one at each location. I have a behavioral health care case manager. And then that's where the Wayne State University Psychiatric Group comes into play. I buy their time. I'm always on the search for a little bit less expensive psychiatric program. But right now we are working with that group, and we buy psychiatric time on Tuesday afternoons for 3 hours from them. And then we do telemedicine visits where the patient typically comes into the clinic, and we arrange the telemedicine with our behavioral counselor with the patient.
Okay, so you have two like psychologists or therapists, but then you also use Wayne State for the psychiatry, for the medical part of it. Okay. Is there a wait list for anyone who, if I wanted to call the clinic and get seen by a therapist, is there a wait list for that right now at this point?
Now there should not be more than a 5-day wait on a behavioral therapy appointment. If there is, I encourage you to tell your patients to call me directly. You know, there should not be that type of wait for behavioral therapy.
Right.
You know, we are now working, we're trying to, the pandemic has stopped a lot of people from coming into any type of clinical office space. And so, as you're all aware, the pandemic rules say when you come into a clinic, you're still wearing a mask. And so everything was released from a lot of different perspectives, but in hospitals and clinics, you know, I'm in my office now here, but if I'm out in the clinic, we are still telling our patients they have to have a mask as well. We provide those when they come in.
Okay. I'm just checking to see if I have any other questions. Oh, yeah. And then I just wanted to note that I did see on the last, I think it was the last slide of your presentation when you showed the number of visits from 2020 to 2021. I noticed from May of 2020 for under behavioral health, there were 82 visits, and then in 2021 it was jumped up to 162. So are you noticing a lot more people reaching out for mental health?
That's a combination of people reaching out for it, as well as getting the full-time service back in our Wayne location.
Okay.
Combined service. I've lost a therapist, and it took me a little bit of time to recruit that new therapist. They're in high demand. That somebody that has the appropriate credentials to provide the service. So we've got them both fully staffed, and you know we're smiling right now with it.
Okay. All right, that is all I had. Thank you. Thank you, Madam Chair.
Thank you, Commissioner Dobb. And I think that is all we have today. Mr. Codis, thank you so much for that presentation and all of the great information you have provided today.
Thank you for the time, and I encourage any of you would like to get a tour or.
Yes, and that's what I was going to ask, if we could set that up again, because that's what we were trying to do pre-COVID, but maybe we could do it as a group. Yeah.
Whatever works out. I think Commissioner Clean might have been here before. If not, I know he's the past chair. Commissioner Anderson, we have a spot in the Wayne Westland Inkster area. You know, Commissioner Dobb, you know, we provide a lot of services. We partnered with Ropeworks in the past, provide those services. So please, I encourage, just give me
All right, we will be in touch. Thank you. Thank you again. All right, Madam Clerk, next item.
Item 3, requesting Commissioner approval of Modification 33 to a contract with 3 one-year options to renew with Black Family Development.
All right, is there a motion for approval?
Move
So
to
moved.
support.
Okay.
Harry
Uh,
can hit it and I'll support.
Any discussion? Matter of fact, the next
What's the motion on the floor?
seven items. This is for the second quarter payment for Black Family Development.
Madam Chair?
Can you hear me? Yes.
Yeah, I didn't hear the motion. 'Cause-
Motion for approval. This is a one-year option to renew for the second quarterly payment
Yeah.
for Black Family Development.
Well, since these are the quarterly adjustments for all of our CMOs, that's what I
Right.
want to hear exactly. I would move or make a friendly amendment to approve items 3 through 7.
Right,
for
that's
all
what I
5.
was just, yep, I
Okay.
just mentioned that. Yep, that's what I was saying. We could take all 3,
Oh.
3
Okay.
through 7 together because they're all.
I'd be happy to move that.
Yeah, okay, great. Thank you.
And that's the
And-
support, Commissioner Marecki.
Okay.
All right. So it's been moved for approval, items 3 through 7, and it's been supported. Any discussion on any of the items? Number 3, we'll look at that. Any discussion? Number 4, 5, number 6, and number 7. There's no discussion. All those in favor?
You want to do a roll call vote?
Yeah.
Yes, roll call, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick.
Yes. All right, it's been approved. Everyone has voted. Is there anyone that opposes this item? And any abstentions? If there are none, the motion passed. Next item, please.
Item 8 on the addenda, communication from the Department of Health, Human and Veteran Services, Public Health Division, forwarding notification of an emergency procurement report for a contract with an option to renew for up to a 12-month extension with the Heat and Warmth Fund.
All right, is there a motion to receive and file?
Commissioner Colleen has a hand raised.
Go right ahead, Commissioner Colleen.
Yeah, I'll probably make that motion, but
Mhm.
we have this item, number 8, as an emergency procurement receive and file with the Heat and Warmth Fund. And then item 9 is a
Is move
contract.
approval, yeah.
So why is one an emergency procurement that we're just receiving and filing, and why is the other one a contract like we vote on regularly?
From my understanding is that the emergency procurement was back in March, I believe. And so that was during the time in which we had to spend down the dollars. But let's have someone from the administration clarify your question.
Yes, this is Carol Osprey, Health Officer, and right, you are exactly right. And we also needed to be able to get the call center services up and running quickly. So as a stopgap through the emergency procurement protocol and ordinance with the county, is why this one, the first one was initiated as an emergency. And then the second one, this was through a full RFP.
Okay. I'll move to receive and file item 8, Madam Chair.
All right, it's been, any other, go ahead. Is that Commissioner Dow?
No, that was Felicia. I wanted to speak to
sure.
Commissioner Killing's question.
Sure.
So Commissioner Killing, this is an instance where they did an emergency procurement for 4 months, and now they're coming back for additional time. So, in the past, we've had conversation about how some emergency procurements extend beyond what appears to be the actual emergency. This is one where the department actually did have an emergency procurement for a shorter period of time, and now they're coming back to you to extend that time out for a longer period.
Thank you, Counselor. I had a feeling that may be what's happening here, and I'm delighted to see that we're getting our cues straight back and forth between the administration and ourselves with regard to these emergency procurements. So thank you for that, Counselor.
All right. So it's been moved by Commissioner Killeen, and did we get support?
Madam Chair, I had a question.
All right. Actually, I see. Go right ahead, Commissioner Anderson.
Thank you. Just to Carol or someone that might be able to answer this question, I understand that number 8 was emergency procurement, but I also wondered what are these based on? I mean, how are they? I know it's impractical to have an idea of how many calls they handled, but when I looked at some of the materials, it appeared as though we were buying additional equipment for this service that's being provided and I don't know if that's going to mean, if someone could explain that, because I saw the equipment that was looked like being purchased or part of the contract. And then I noticed that looking at the numbers here, this for a 12-month period is much higher than the other emergency procurement, which I understand that maybe was for a shorter period of time. I haven't done the actual calculation of the number of months, but this new one would be for 12 months. And it looks like it's, again, at a time when things are, the number of cases seem to be dropping in a very strong way. So I just wonder, is that going to be paid out regardless, or how is that going to be adjusted for the declining numbers of requests for vaccinations?
Right, Commissioner, again, Carol Osterberry, Health Officer, great questions. And yes, when the call center started out, you're right, there was communication equipment that was purchased. And then the new contract is with them operating 7 days a week so that we can offer good, more comprehensive services for our residents. They are finding that they have people who are calling on the weekends, and anyone who calls and then they get a call back the next business day, but this is going to increase our, service to our residents. And also the hours with this new contract are going to be 12 hours a day versus now they only operate from 9 until 5. So again, increasing those hours, the person who is coming home after work, or even they're finding they're getting a lot of calls even first thing in the morning from 8 until 9, because they track all of that and give us comprehensive reports every week for the calls, where the calls are coming from, demographics. So we are getting a lot of very valuable, rich data from the call center that, you're exactly right. Then we can target more which communities, populations, the right times to be offering these services for our residents, to be able to easily make, an appointment for one of our clinics. And as Mr. Coach has even said, all of our clinic, for his clinics, for the FQHC, all of our clinics are also, you can walk in, you don't need an appointment. You get, right automatically, then your appointment is made right there while you're standing as part of that walk-in.
Okay, and with respect to the number of cases that are coming in, how are we tracking that? I mean, I know now as you mentioned also that it is dropping off in very small numbers as compared to before. And I understand that some of the clinics that are open are, going for hours and only getting a handful of people. And then also the last question would be that equipment that was purchased under the first emergency procurement. What happens to that equipment? Does it remain with them even after the second contract ends? I'm not sure what the value of it is. I didn't look at the total value, but is that taken into consideration in the contract, or is that coming back to the county, or what happens with it?
Right, right. Great questions. And yes, as we've said, we're tracking, and, as Dr. Hamami just, reported, I mean, we're very excited about, the numbers and that they're going down, but, not the whole, aren't at that 70% or plus vaccination rate for the whole county. And again, like he was talking about with the variants, and, we are track these things very closely and are, monitoring where our cases are, where our calls are coming from, where where the people are vaccinated rates, and then the places in the county, the geographic areas where those vaccination rates are lower. We are starting, just looking at all of that data. And, and like I said, the call center is helping us tremendously every week with their reports, what they're bringing in on, even right after the vaccine, the Pfizer vaccine was opened up for age 12 and above. Then we saw, a lot more of those appointments were being made for that population. And that's why then we even got out in the schools, because we knew that was the need of the community. As far as the equipment that you're saying, yes, the equipment will be then even used, for those staff that are through the second agreement, and the equipment is part of, ultimately is the county's when this is done.
Okay.
Commissioner Anderson?
Yeah.
Yes.
This is Melita Jordan. If I could also add to that, just wanted to share also that we do have the data from the zip codes as well as.
I'm sorry, Ms. Jordan, can you give your name and title? You said your name, but your title.
I'm sorry. Melita Jordan, Director for the Health and Human Services and Veteran Services.
Thank you.
Okay, I'm sorry.
That's okay.
I just wanted to add that we do have data for the census tracts as well as the zip codes. And so although we have some numbers, as Carol mentioned, that are coming down, the numbers are not coming down in all of our specific areas that we are looking at. So therefore, we still have large numbers of residents who have not been vaccinated. So we're trying to get down into the neighborhoods now to do essentially door-to-door knocking and a canvassing so that we can get more uptake, particularly in those areas where people are not getting the vaccine, not just because of hesitancy, but also just of a lack of information and perhaps not a lack of access. And some of the sites that we currently have, as you clearly mentioned, we've had some low numbers at some of those 6 sites. So we're trying to drive traffic to those sites by doing the door-to-door knocking, canvassing, and also dropping literature at the various businesses, such as the beauty parlors, the nail salons, the laundromats, and so forth. But in addition to that, it's to the equipment that was also used was to make sure that on site, if a person wanted to register, they could register on their computers, so to speak. That would also give them access to the call center. And then the nurses would have information when that person also showed up at the various sites. That information would be in the database so that we know that individual is there. And so that equipment is being used also to help with the initially work that they were doing, where people were actually writing information in. This way, they're no longer having to do handwritten, which has given us less accurate data. This way, automating it is helping us to be able to have more accurate count, to also assist in having more accurate data that we're collecting so that we know where we need to be focused in these communities and neighborhoods so that we can get an increase in the uptake for the vaccines.
Thank you.
All right, thank you, Commissioner Anderson. Were there any other questions from members? No other discussion? So we're on
Support the motion.
Item E. We have a motion and it is now supported by Commissioner Dobb. All those in favor, let's do a roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick,
Yes. Any opposed? And any abstentions? If none, the motion passed. Next item is. Go ahead.
Item 9, requesting commission approval of a contract with an option for up to a 12-month extension with the Heat and Warmth Fund.
Move for
All right,
approval.
it's been moved. Any support? Anyone supporting?
Support. I'll support.
All right, it's been moved and supported. Any further discussion on this item? We basically discussed it in the last, within the last item. All right, all those in favor, a roll call vote, please.
Commissioner Marecki,
Yes.
Commissioner Dobb,
Yes.
Commissioner Anderson,
Yes.
Commissioner Colleen,
Aye.
Chair Baker McCormick,
Yes. All right, it's been, this motion is approved, it's passed. Next item, please.
F, such other matters as may be properly submitted before the committee.
There are no such other matters. Next item, please.
Public comments.
Are there any public comments? Anyone on the line? If you can unmute everyone. Any emails?
No, we haven't received any emails.
And anyone on the line? It appears that there are no public comments. Next item, please.
Adjournment.
Is there a motion?
I'll move to
Make the
adjourn.
motion to adjourn.
All right, so moved and support. Thank you.
Thank you.
All right, bye-bye.
Thank you.